The Ebola virus disease that was first declared in Mubende district on the 20th of last month has now spread to other 4 districts: Chegegwa, Bunyangabu, Kasanda and Kagadi. As of 4th October 2022, there are 43 confirmed cases of Ebola virus disease and 10 deaths, including 4 health workers, with the latest being an anesthetic officer aged 58 who passed on at Fort Portal Hospital.
There were 6 patients in the Ebola treatment unit. Unfortunately, on a sad note, we lost one of the patients. This is Margaret Namisobi, who was the anesthetic officer working in Mubende Regional Referral Hospital. She died this morning at around 4:30 a.m.
Bringing the total number of health workers who have succumbed to 4. Very painful. Usually in a war, at the front line, as somebody said, they are usually casualties. But it is important that we protect the health workers. It is also important for health workers to understand that in their normal day-to-day routine work, they need to protect themselves, because we don't know what a patient will come with. So it is pertinent that they put on their gloves, keep their masks on, use aprons.
Health development partners are now supporting Uganda to curb the spread of Ebola virus disease, and the United States Agency for International Development, USAID, has donated assorted materials for infection control.
That consists of equipment and supplies that are sufficient to take care of a number of patients over a 10-day period, to be able to help them get through that initial critical stage. This is symbolic. It's not about this kit. This kit is a tiny, tiny piece of the support we're trying to provide to this effort for the Ministry of Health. And the United States government is active in a number of different areas within the response under the direction of the Ministry of Health, so that we can all together resolve this crisis as quickly as possible.
So this kit that we have received this morning will go a long way. As you have heard, this kit can go on for 10 days. When you look at it, it looks small, but there are many, many, many wares in there for the health workers to put on and enter into the isolation facilities. The health workers currently taking care of Ebola confirmed cases are heroes, because not many people want to go into the isolation facility, and we deeply want to appreciate them.
The World Health Organization commended USAID for extending assistance to Uganda and appealed to the Ministry of Health to ensure that those who get infected with Ebola get medical attention faster.
And that process also involves protecting the health workers, which would be providing that kind of services. Generally, what the Ministry of Health, in collaboration with partners and WHO, tries to make sure is that whenever we have Ebola or similar disease like Marburg, we deploy one of these to the referral hospital within less than 24 hours, so that even the first case gets all the benefit of care, as well as the health workers which are providing the services are well protected.
Last week, the ministry announced a 3-month Ebola response plan at $18 million, which is approximately 65 billion Ugandan shillings. I'm Nafka Farida and Adia Nakuti.